Okay guys, here's 3 simple Pilates exercises you can do for the neck, and these are ideal to do after you've been through the passive treatments using the blades or other techniques. Firstly, there's the upper cervical flexion, which works on the deep cervical flexors, and it's good to work on those and to strengthen those. It also gets the neck moving and mobilizing, and we're also looking to reduce activation of the larger muscles such as the SCM from popping up as well. So this is not a head lift, it's a chin nod. So for that reason we want something slidey to put underneath the head. So it's going to lift your head and that's it. So I've put down one of our workbooks under there, which is a nice shiny surface. So now you should be able to tuck the chin in and lift the chin using the magazine underneath to slide the head. Okay, now it's a gentle movement. We're not forcing the head back, we're not lifting the head, it's the upper cervical flexion, that chin tuck. You are literally trying to form a double chin for the purposes of mobilization. We can then feel and make sure that the larger muscles aren't tensing up and protruding on the neck, which hopefully you can see they're not, and also we can feel they're not as well. So if you can go ahead and do some gentle chin nods. That's it, thank you. Okay. Paying attention to the overall body position, I'm going to ask you to pop your knees up. The reason I've done that is it just takes some of the strain off the lower back. I'll then ask you to put your hands on your pelvis and tilt your pelvis forward and back, and then make sure your pelvis is in a neutral position. So a neutral position for the pelvis and lumbar spine. Great. Now place your hands over your lower ribs, and we're focusing now on the breathing, just a bit more around the back of the ribs there. Breathing should be not from the chest, but from the diaphragm, and particularly expansion of the lower ribs. So it's that nice relaxed expansion, not too chesty, more diaphragmatic breathing, ideally through the lower rib expansion and not forced expansion of the stomach. But nonetheless, the breathing should be relaxed. Next, place your hands over your ribs. The ribs shouldn't be flared, they should be relaxed and neutral. So mainly just to relax the ribs down a bit, flatten the spine so that the ribs aren't flaring up, which can sometimes occur. And then onto the shoulders, put your arms by your side. Okay, pull your shoulders back and down. That's it. Reach your hands down towards your feet and then relax and bring them up a little bit. You don't want the shoulders up here, obviously, but you also don't want the shoulders to be dumped down like your hands are going into your back pockets. That will traction your nerves and probably cause some discomfort and tingling in your hands. So just putting the shoulders into a conscious but relaxed position. That brings us back up to the neck again, and at the neck we're doing the chin tuck exercise, sliding up and down. This is not a strengthening exercise as such. You're not going to experience muscle fatigue with this. Instead, we're working on and activating those deep cervical flexors, a muscle group known as your longus muscles. How many of these are you going to do? Well, you could give them some repetitions, like 10 or 15, but I usually like to go for time, so we say like 30 seconds. Therefore, rather than counting, they're focusing on the quality of the movement, doing 30 seconds of slow, controlled movements, and that's the first one. Now, the next one is a bit more complex, but a bit more helpful and a bit more exciting, so let's have a look at that one. If you can turn around onto your front, please. Okay, and rest up on your elbows. That's it. And with your hands kind of in that diamond position there. Okay, so up into this position here, the pelvis is down. Firstly, shoulders. I want you to bring your shoulders back and down so that you're activating the lower trapezius muscles and you're pulling your shoulders down towards your back pockets. Okay, activating around the lower trapezius, yeah? Okay, next I want you to imagine that there's something pushing up on your sternum, so just lifting up a bit more from your sternum. But when you do that, you want to stay relaxed around the lower back. We want to make sure the lower back is not arching into extension. The movement is in the upper torso and the thoracic region. Okay, so shoulder blades back and down, sternum is up. Now look at the head. The head is what we need to pay attention to. So let your head hang down and drop right down. No, it's still there. Let it hang. Let it go heavy. Let it drop. That's it. Just like switch your neck muscles off and let your head drop down. Okay, so it's fully relaxed. Now tuck that chin in if you haven't already, and then I want you to vertebrae by vertebrae, I want you to bring your head up whilst keeping that gentle chin tuck in so that you're rolling up one vertebrae at a time. This is like the lumbar roll that we did, but it's the cervical version. Coming up, great, good, and then tuck the chin in again, lovely, and then vertebrae going down, one at a time, letting that chin drop down. So in your mind, you want to imagine that the neck is like unfurling and coming up, almost like a fern coming into season, if you will, and coming up into that position there. We're not going right up into extension, that's not necessary, just as far as is comfortable. It's that flexion down and then rolling back up from that position as well. Paying attention to that deep cervical flexion, but really getting that curvature and extension through the spine. Okay, how did that feel?
Really nice.
Yeah? Sometimes when you do that, you can feel some cavitation vertebrae by vertebrae if you get it right. You need to coordinate those muscles to get that movement to occur. So that's the cervical roll down. It's a less well-known and less common version of the very common lumbar roll down. All right, next, can you turn onto your side, facing away from me? Okay, side lying position. Give you something just to rest your head on there. Okay, knees up like so. Okay, so knees are up, that's good for stability. Place your arms out like that, that's great. This can be done on the floor or on the couch. Should be perfectly fine to do on the couch here. Now, what I'm going to ask you to do is to lift this arm up and over, and you're doing what I'm going to ask you to do, which is following your hand. Your head and your eyes follow your hand. Great. Keep going, as far as you can. That's brilliant. Great. And back again. That's it. Bring it over there. Placing the hand on top of the other hand. Good. And repeat. Following the hand. All right. We haven't paid too much attention to breath yet, but we should do. It helps to exhale into the end of range, relaxing the rib cage and hopefully helping you to get a bit more movement as you reach the end of range. Okay. Of course, there's cervical rotation, which is helpful when you're rehabilitating the neck, but also the fact that you're following and tracking your hand also has extra benefits for improving the cervical range of motion, because one of the main things that our neck does is serve our senses, particularly vision. So if your neck is working to help follow the hand in combination with vision, it provides a bit of a distraction and takes the onus and the focus off thinking about movement and pain. It's more of a functional following of the hand. Okay, you look like you're enjoying that one.
Yeah, nice one.
Okay. All right. Okay, and we'll stop there. So those are 3 simple Pilates exercises for neck pain that you can do at any point, but I thought they'd be a great addition to do after we just did the tool work around the neck.